What's up, everybody? I'm Katie.
And I'm Morgan.
And this is For Your Misinformation, a podcast dedicated to empowering women to become more politically engaged so we can act in our own best interest.
Let us identify the problem and tell you what we're doing and what you can do to help solve it.
Hi, Morgan.
Hi, Katie.
How are you?
I'm pretty good. I'm not letting this pandemic get me down. How are you?
I'm good. Same for sure.
Yeah, it's just our new normal now.
Right. Yeah. I mean, we are adjusting. We are resilient.
Yes.
Okay. What are we going to be talking about today?
Oh my goodness. I am so excited about this episode. We are going to talk about Medicare for all.
Yes.
I'm sorry I sang that, you guys. Sorry. I'm just really excited.
I think I'm in kind of a weird mood. I've had sort of a long day, so we'll see how this goes. But
Yeah, I'll try like my best to not let this be the longest episode of any podcast recorded ever, but we are public health people, so we love this stuff.
And we're in the middle of a pandemic, and this policy would directly impact this pandemic. But okay.
It is super relevant.
Right. So, okay, speaking of coronavirus, we had a question from an Instagram friend who asked how scared she should be and to please like back it up with numbers and statistics. And like I answered that question on the episode that came out last week with the interview with a nurse about COVID-19. But I wasn't like super pleased with that answer, but I think I've like come up with like a better way. I don't know. We have a little bit more information now, and I think this is like a better way of thinking about it. But right before we started recording, so we're recording on the evening of April 1st, we just hit 5,000 Americans that have died like today, just in the last couple hours. So the total as of when we started recording this was 5,094 Americans. For some perspective, just under 3,000 died on September 11th. So it's already significantly more than died on September 11th. But also what we know now is that the federal government is projecting their goal, and goal in quotations, that was the word they used. It feels like a weird word to me, but their goal is to have a death toll between 100,000 and 240,000. So the conservative estimate is that at least 100,000 Americans are going to die. And as of the time of this recording, 5,000 had died, meaning they're projecting at least 95,000 more Americans will die before this is over. On the low end and on the high end, it might be as many as like almost 250,000, 240,000. So if you want to think of it as like a loading bar, we're like 5% of the way through. So like that's not
it's not good.
It's not great. Yeah. But just to like set expectations, and I don't know, it's important to know like what to expect, but those are the numbers. That's what we're working with. That's what we're looking at.
Yeah. It's not great. But also you can do things to help lower your chance of being one of those 100,000 people.
Yeah.
Or being the cause of one of those 100,000 people. So just keep it up with the social distancing and the hand washing, and we'll get through this.
Yeah.
And if you or someone you love has been one of the people that has gotten this and you've gotten really sick or not survived it, we are sorry. And, we're like giving you a hug through podcast form.
Virtual hug.
Which is just me making heart hands.
Yeah. Which I can attest to that she did indeed make heart hands.
Yeah. It's how you give a hug through a podcast. Yeah. It's great for an audio only media.
Yeah.
Okay, but really, don't give any hugs.
Yeah, don't give hugs. Don't get within 6 feet of people unless you live with them.
No hugs. Foster more pets because you can hug them.
Yes. Oh, I actually did just get an Instagram message about somebody who was thinking about fostering a cat. So think about it. Yeah.
I'm so happy.
Yeah. Okay. So, but this is like intricately in tied with our healthcare system, right?
Yeah.
So when you hear people talk about Medicare for all, like essentially what they're talking about is a structure that would replace private health insurance with like a single government run program that would cover everyone.
Medicare for all is just a generic term for a single payer American health plan. It's not the same as putting everyone on the Medicare program that we have for seniors right now,
right?
Which is, by the way, A, not free, and B, not just one single plan that everyone is on the same plan. C, would take a lot longer to explain exactly how Medicare works than what we're going to take time for on this podcast.
Yeah. But I would say from a public health perspective, like a health equity perspective, a social justice perspective, healthcare should be understood as a human right, like full stop. And we have some work to do in this country in terms of like what we prioritize. And this is an example of something that the government can do a better job of than the private sector, because all the private sector is motivated by profit. But in healthcare, your goal isn't profit, or at least it shouldn't be. Your goal should be that you have a country full of citizens that are healthy and can thrive. Like, your country is better when its citizens are healthy. So it's putting value on a different thing instead of like a monetary value. It's like a health value.
Right. It's a value, meaning like more access to healthcare, more health equity means less money, might be spent in certain areas, more in other areas. But in the end, it means a higher quality of life and improved health for people, which is a huge benefit to this entire country.
Yeah.
And that is important.
Right. So the way that it's set up right now, we have a multi-payer healthcare system, which means that, it means a lot of different things. It's very complicated. But basically what it boils down to is that, like, if you can afford it, you can get high quality healthcare in the United States. But overall, the United States healthcare system sucks. Like, we are infamous around the world for having unequal health outcomes in our health system. So like, some people can afford concierge doctors who will make like house calls, while other people are rationing their insulin because they can't afford as much as they need due to price gouging, which is, we could do a whole other podcast on the issues with the pharmaceutical industry.
But well, and that's the thing, like health reform, like we're talking about, healthcare reform is scary, and we get that.
Yeah.
It's complicated, but something dramatic like actually does have to happen, because right now healthcare is like 18% of our nation's GDP,
which is crazy. It's like twice as much as any other developed nation.
Yeah, exactly.
Not an exaggeration.
Not an exaggeration. It is twice as much. And yet we have very high obesity.
Yep.
And we have high infant mortality.
Maternal mortality too.
Exactly. And a lower life expectancy compared to other high income countries.
Yeah.
So like, this is a very important thing. Yes. And it's, people are going to have different opinions, but in my opinion, our opinion, maybe even, like this is the biggest issue we face, maybe along with climate change right now, because it just seeps into so many other things. Mm-hmm. Like, this is a huge thing.
Yeah. And another thing that I think we probably think about a lot, because we view everything through the lens of public health, but prevention is much cheaper than treatment. So when everybody has access to healthcare, when it's just like defaulted to you as a citizen of a particular wherever country you're born, it's you get vaccines so you don't end up getting sick, and vaccines are much cheaper than actually like getting treatment for the flu or something like that. Or same as like dental checkups. Like if you keep up with those, then later in life you don't end up spending a ton of money on crowns or whatever. It's just like anything that you can think of, any health issue, like the sooner you can do screenings and catch it or prevent it altogether, like that is one, better for the person, because nobody wants to have to recover from cancer. They just want to not get it in the first place. So, and all of those rates get better when people have better access to healthcare. Did that make sense?
Yeah. Oh, yeah. And like, and just everything is better. I mean, it's better to have a country of people who are happy and healthy.
Yeah.
And not panicking that one accident or injury or one illness or they're
getting fired from their job
or getting hurt or getting fired could just sink them forever.
Yeah.
Like that should be a major stress.
We're the only country, only like developed nation where you can go bankrupt from medical bills, which are totally and completely out of your control. Yeah. So, yeah. So I don't know. There's lots of reasons that there is unequal health outcomes in our health system. But the big one is that our healthcare system is for profit. And I talked about it a little bit earlier, but it's pretty fucked up because the goal of the healthcare system should be to take care of people, not to maximize profit margins. And most other developed nations have a single payer healthcare system, meaning there are no insurance agencies acting as middlemen. The government just covers essential healthcare.
And I don't know if this is too into the weeds, but I can give a brief background on like the 4 major models of healthcare systems, if you would like.
Yeah, I mean, yeah, let's do it. Why not?
Okay. I'll try not to be like super nerdy.
Okay.
But okay, so the model, like what they have in Germany and quite a few other countries, sometimes they call it the Bismarck model, but like that's not the important part, is that healthcare is financed through nonprofit insurers. They call them sickness funds. So it's paid for by employers and employees. This is not unlike what we have right now, right? With employer-sponsored healthcare system that not all, but many Americans do have. However, it's better. So the actual healthcare is provided by private doctors and hospitals, just like in the U.S., right? But the sickness funds must cover everyone. So everyone in the country has to be covered by this. If you want to, however, you can opt out if you choose. And it works better because there is strict government regulations, because it is still a multi-payer model, but there's like 250 different funds and everyone has to be covered. So if one of these funds is like not going to cover or reimburse something, or because they are private doctors, private hospitals, they're going to charge like a ton. Well, there's 250 different people in competition there, right? It's like, even though it's quote unquote like socialist medicine, it's like almost also like capitalism is purest, most well-working, well-oiled machine form.
Yes, because of what you said about it being heavily regulated. So
because
when
it's regulated,
I have been,
don't have that.
Right, exactly. So many of our institutions and systems are for profit and really poorly regulated, which is why we're like we're in the middle of like late stage capitalism and our whole country is falling apart. But again, that's probably a topic for another episode.
Yeah. So the model like they have in the UK and a few other countries, the beverage model, again, that's not the important part, but is healthcare financed by the government. So healthcare is provided by the government. The government owns basically all of the hospitals and healthcare facilities and provides the salaries for the doctors. So if like you're in Britain, the hospitals are government run, if the NHS doctors are government employees, costs are low because the government is the single payer.
Mm-hmm.
And the government's not going to be like, yeah, let's have high costs.
Right.
No, that's not what they're going to do. And if you think about it, this is like the same thing we have for a model with like the VA in the United States, right? It's government owned, it's government run. The government decides what's paid, how much things are worth.
Mm-hmm.
If you are covered by like your Veterans Administration benefits, like that's where you go for healthcare.
Yeah, right.
So it's kind of like that. And then what they have in Canada is kind of a mix of the two that I just mentioned. So again, the government for like Canada's national health insurance program is a single payer. And that is what leads to cost control. But the hospitals are private. So again, it's kind of that weird mix of the two.
Mm-hmm.
But the hospitals, even though they're private, are paid at a government rate. So healthcare is financed by the government, but provided by the private sector, which is, if that sounds familiar, kind of basically like Medicare is in the United States. And so, and then of course, there's also the fourth model, which is just no insurance, right? It's just out of pocket expenditures. It's people in the US or in countries that don't have a health system that if you need medical care, you just have to show up and pay out of pocket.
Mm-hmm.
We have all of these in the US. So if you are confused by how healthcare in the US works, you're not alone, because it is confusing and it doesn't make sense. And the whole thing is really out of control and messy. And that's why we need it to change.
Yeah. And I want to be clear, like Obamacare was definitely a step in the right direction. I saw firsthand back at my old job when I used to write the community health needs assessment, what happened when a huge chunk of our community was able to access healthcare and all of a sudden could get like preventive screenings, like all kinds of health outcomes got better. Medicare for All is taking that a step further, basically, and just making sure, that healthcare is a human right, essentially.
Yeah, I mean, in some other countries, it's regulated just like any essential utility, like water and electricity. It's regulated like a utility, maybe even internet, which should be a utility, but that's a conversation for another day.
True.
Also related to the pandemic and all the kids trying to be homeschooled right now.
Yep.
We're sorry, family. You're doing a great job.
Yeah. Is your kid alive? Did you feed it today? A+.
Yep, you're doing great.
So yeah, like you said, we have lots and lots of different payers, as all the different health insurance agencies, and they all pay varying amounts for the same procedures. And all those payers also require a lot of administrative positions, which is why our system is really inefficient, because for every 3 doctors in the US, there's 2 billing staff, which is it's just crazy inefficient.
Yeah, that's insane.
Yeah.
And that's where so much cost saving comes from.
Exactly.
With single payer is administrative costs.
All the money flows through the government, from the government to the doctors. So there's no like intermediary. And people say like, oh, well, that's providing jobs. It's jobs that could be going to like green sector stuff that would actually be like helping with climate change. I don't know. It's just, it's unnecessary. It's not, and it's part of the reason that our healthcare costs are so high. It's just not efficient.
Yeah, it's not. And like that's one of the key things that has to change, right? And that's one of the good parts about something like Medicare for All.
Yeah.
Same with, you kind of mentioned this too, is to control costs, we need to require consistency. Mm-hmm. If I ended up in the ER right now and they ran a pregnancy test, which they would probably do with or without my consent or explanation that no, I'm not pregnant, because they can't do anything that might potentially hurt the baby that they're potentially probably isn't. So they'll do one anyway. And I could be charged anywhere from $5 to $500 for that, just depending on where I was and how much they decided to charge that.
And if it was in network or out of network or
And plus I could also be charged a quote facility fee, which is basically like a cover charge to the ER, where I could be billed hundreds of dollars, even if I just left the emergency department with a Band-Aid or something, or 2 stitches later, which is also inconsistent and not cool. And like anybody who's ever been to a doctor or hospital or, ended up in an ER knows like you don't know the prices until it's
Yeah.
way back.
Well,
Like
and also
you
like
have no idea.
that's not what you should have to be thinking about right now.
Mm-mm.
Like you shouldn't have to be worried about being taken advantage of. You want to feel better, you want to get better. But in a single payer health care system, the government sets the price. So if you go in and for some reason they have to give you a pregnancy test in Iowa and I go in and for whatever reason they had to give me a pregnancy test here, it would cost the same no matter what. Like there's no like shady business going on, which by the way often gets dumped on the uninsured. That usually the uninsured end up paying on average 4 times more for the same procedure than if you went into the emergency room for the same thing, but you had Medicare, because so many people are on Medicare, Medicaid, and the VA insurance. They have a lot of bargaining power. And like econ is not my thing, but they can say either you'll accept our rate, which the rates are like fine. They'd be better if it was better funded. So like
they're comparatively very low, which
yes,
is why some clinics and
don't
locations
like to
don't
accept
cover those, and they don't
yes,
accept those patients.
Yes.
Which also really sucks. Like
yes,
that's not how it should be.
Right. So yeah, so they're able to say like this is what we'll pay for a broken wrist. I don't know what I'm talking about, but you don't have anybody lobbying for you if you don't have insurance. So if they tell you that that's broken wrist costs $4,000 instead of $1,000, then like you don't have a choice but to pay it. You just
exactly. And speaking of lobbying, a lot of people will point to like we shouldn't do a single payer healthcare system because the American Medical Association says no. The American Medical Association is a lobbying group. Like they are lobbyists. They're the biggest lobbyists for the healthcare industry, not for actual physicians. In fact, a lot of, not all, but a lot of physicians say like, yeah, like single payer is fine. It would actually have a really big benefit. Now granted, of course, like American doctors are paid a lot more than their counterparts in other countries like Canada and Europe. And so I'm sure that they would kind of
debt.
hate that. But yeah, they also have a shit ton of debt. And like the AMA doesn't speak on behalf of actual like individual physicians. It is a lobbying group.
I didn't know that.
Yeah.
That's interesting.
And a lot of people don't know that. Mm-hmm. And like all lobbyists are not bad inherently, but it is important to know that when you are looking at things like this.
Yeah. And the other thing is we don't have to like imagine whether we would like it better or not. You can just look at satisfaction rates in other countries that have single payer healthcare systems, or the other systems that some of the other systems that you talked about that are subsidized different ways, but not the way we have it. Like Germany, man, now I'm blanking. Did I write it down?
I mean, Switzerland, Netherlands, they all
their health, their satisfaction with their healthcare is way higher than ours.
And their outcomes are better than ours.
And their outcomes are better, and they pay less.
Way less.
You have to wonder, like, why we don't do that. And the answer is it would be hard, but also
it would be hard.
It would be hard, but it's also the right thing to do. But also, like,
these are people's lives, and it should not be a partisan issue.
Right.
But it is one in this country, and that is a damn shame.
Yes. And that it's because, so there's a lot of money in American politics, which is another thing that is a problem. But officials can be lobbied to vote against whatever, and Republicans are often receive a lot of money to oppose Medicare for all. Mm-hmm. And it's because insurance agencies make a shit ton of money, and they have a shit ton of money to spend to buy votes and stuff like that. So I know that's depressing, but it's just another reason that Medicare for all is a much, much better like option for our country, even though it's harder. We can do hard things.
Yeah, we can do hard things. Like major healthcare reform is hard and it is slow work. But we are reaching a crisis point of unaffordable healthcare in a completely broken, disastrous system. And maybe that's going to actually lead to policy change happening a little bit faster.
Yeah, I hope
especially
so.
right now. Hello, pandemic. And, like changes like this always come with growing pains and cause a lot of conflict. If you look at the progression of these coming to play in other countries like Australia, I mean, there were like riots, and even in Canada where people are way nicer than they are here. It was a big deal, and a lot of people were not happy about it. There were, for lack of a better term, growing pains. And some of the challenges will be uniquely American when we inevitably do end up with a single payer healthcare system, because, it's going to have to happen eventually.
If our democracy exists.
Right.
Still.
If we still have a democracy or we still have America,
Yeah.
We'll have to have one of these eventually. And there will be problems, and some of them will be the same as other countries go through, and some will be uniquely American because of where we're starting at, with costs being so high and so much money being wrapped up in it.
Yeah.
Like we can't just go to all physicians everywhere are now reimbursed at the same rate as CMS, like Medicare, because that would be way too much too fast.
Yeah. But these plans have transitions in place. Like I think one thing that I hear a lot is like what Joe Biden and Pete Buttigieg were always saying is like, if you like your health insurance, you can keep it. But like nobody likes their health insurance. They're just scared of change and they don't know what the other option is. So this is what the other option is. But that I hear that argument all the time. Like when people talk about like how we're going to get from that, the system that we currently have to Medicare for all. And it's just like, do you think Elizabeth Warren didn't think of that? Like people have been thinking about these policies for years and years. I mean, Bernie Sanders has been talking about it forever. Like they have plans in place, and I mean, they're boring, but like first it like lowers the age of Medicaid or Medicare to 55 instead of 65. And like it starts doing that every year or every whatever. And then all children under the age of 18 are on there. And then everybody has an option to join in. And then it's a transition over time, just like everything else. Like change is incremental, but there's a plan for that.
There is a plan for that. Should we talk about some of the different versions of a single payer or Medicare for all program some of the candidates have kind of mentioned?
Ugh.
Even though they're like boring, we'll try to make them fun because we are hilarious.
This is a hard thing to make funny. I mean,
I know
it's really interesting, but it's not really funny.
I know, and so worried about that too. I'm like, am I the only one who finds this interesting?
Yeah.
No, Katie finds this interesting. Yeah. Okay, well, are we the only two nerds who think this is interesting? I don't know.
I mean,
but
people keep listening.
Like, there's a lot of different ideas floating around out there for how it works, and like the big idea with all of them is long-term cost savings.
Yeah.
They're all trillion-dollar plans.
Yeah.
But like, so is what we have now.
Yeah.
Which is just kind of like a disastrous, like tornado that doesn't have necessarily like planning or logic to it either. So it's like, well, it's fine. Like all of the estimates suggest that a single payer health system would save money. And especially for like Elizabeth Warren's plan, saving for the middle class right away by one of the most immediate things in her plan is cost savings for prescriptions, right?
Yeah.
So, that's a big part of a lot of the plans that different candidates have suggested, but that's like day one for her, is that, and reducing out-of-pocket costs.
Yeah.
And, then eventually with like a full single payer system, like there's market power to negotiate lower prices.
Yep.
And in terms of how it's going to be paid for, some of the ideas floating around there, like Kirsten Gillibrand?
It's either Kirsten or Kristen. Kirsten.
I think it is too.
Kirsten.
Always, to all Kirstens and Kirstens in the world, I am sorry, because does anybody ever get your name right?
Probably not.
But yeah, like, what
it
she
is
suggested.
Kirsten. Good
It
job.
is Kirsten. Okay, good. And was, like 5% of your income or something buys into healthcare. But despite income-based buy-in, it's not a for-profit system like we have now. And also, like, probably already I spent 5% of my yearly dollars into healthcare.
Yeah,
and like,
for sure.
I'm a pretty healthy person.
Yeah.
Like, it's, it's crazy.
Yeah.
And kind of coming back to Warren's plan and, is the huge amount of savings that she demonstrates through controlling those administrative costs, right?
Yeah.
Like, in this country, there is already taxpayer-funded health spending. And if you did not know that, you have not been paying attention. But you know it now. There was already taxpayer-funded health spending in this country. It's a Medicare for All program redirects those funds. Yeah. It doesn't ask the middle class to just like come up with more in a plan like Warren's. It's very detailed with how the costs are leveraged with the savings.
So so we have two technically candidates left in the Democratic primary. What's like, if you were going to like compare and contrast, I mean, and they're probably the two like most polar opposite plans.
They are.
In that Bernie's is probably the most generous and Biden's is I'm mad at him.
I am too right now. Do we have to talk about Biden?
No. Well, I just wanted to I could not believe that in some interview he was asked if he was president and a Medicare for All bill came to his desk, he said he'd veto it.
Yeah.
That is such utter bullshit. It should be
like you haven't
disqualifying.
even read this bill, sir. It's like,
but also,
dude.
That would mean that both the House and the Senate passed a Medicare for All, and then you're gonna say no? Like,
I'm very mad at him about that.
Yeah. Okay. Yeah. But yeah. So what are like the differences? How would my life change?
Biden doesn't really want your life to change, right? I mean, he obviously had a lot to do with like Obamacare, aka the Affordable Care Act,
right?
And so he'd like to see that expanded stuff, which is still something and better than just like continuing to roll down a hill like we are right now. But Bernie's plan is super generous. It includes like no out-of-pocket costs, and it's even more inclusive than a lot of the other countries who have single-payer healthcare.
Like, we're talking, imagine your dental care and your, what's the other one? Oh, vision and health insurance were all the same because your teeth and your eyes are part of your body. So you didn't have to have like separate insurance for those two things.
Imagine your teeth not being considered like luxury items that you have to pay extra in order to keep in your mouth.
Right.
That's crazy.
Imagine not having to deal with your insurance agency because the government pays for your health care.
Which also would be great.
Yep.
Because my old insurance was the worst to deal with. I haven't really had to deal with my new one much right now, but my old one, literally, like, I won't even say their name right now. But yeah, so Bernie's plan is paid for with tax revenue, which is like a lot of our peers in Europe, but also like his is completely paid with that. A lot of like the European models still have like a $5 to $25 copay for certain appointments and stuff, and his doesn't suggest that. Canada's is copay free though, so it's not like we would be like the only country that doesn't do this. America's hat, in fact.
And like this doesn't exist. We can create it. So like we can take the best parts of everything else. I mean, that is like maybe the silver lining in all of this is that like we're late to the fucking party because we haven't adopted this way of thinking yet, but now we're now creating something that we can at least base on other people's successes and failures.
Yep. And especially because like in theory, Bernie's plan could allow for private insurers to still have a place in this world. They would not be able to cover services that our Medicare for All or whatever other national healthcare program we had.
So maybe like
cosmetic procedures
yeah.
and those kinds of things.
Yeah.
Which
Okay.
I would be way down for. Be
Yeah.
like, yes, give me all the cosmetic procedures because I am saving so much money in just like my regular doctor's appointments and prescription medication. So I'm going to get like my boobs done or a nose job or a butt lift or whatever.
But no,
Just because I can.
we're in America, so we can't afford. We just have
Teeth?
to look
We
the
can't
way we were
afford
born. Okay.
But yeah, like that part of Bernie's plan could appeal to some folks out there who are like, no, but I love my health insurance. What would I do if I didn't
don't think those people exist.
2 hours just to talk to Loretta so she can tell me that, yes, this is covered at the clinic that I want to go to. And then after I go to that clinic, I get a bill and I find out that it was $400 for my pap smear.
Yeah. No, truly, like most of my day is spent like arguing with insurance agencies on behalf of my mom. Like it is exhausting and there's a better way. But okay, you touched on this a little bit already, but I hope people like hear it nice and clear. But a lot of the time, the argument that you hear against Medicare for All is that it's socialist and that socialism is bad and scary. But like Morgan said, we already have versions of socialized medicine in this country in the form of Medicare and Medicaid and Veterans Affairs. And you might be thinking, well, I heard the VA is a mess. And you are kind of right, but that's because Republicans have spent the last few decades defunding it and defunding all kind of other like prevention programs because in my opinion, they think more short term than long term. So with proper funding, single payer healthcare can be awesome. Like programs, it is like a really good idea, and that's like reflected in other developed nations.
Yeah, it is. And so, people like to talk about also like you'll have to wait forever to get anything done. I mean, that can happen. Yeah, it also can and does happen here too.
Yeah.
And it's not like, oh my gosh, well, you had a lump on your breast, but then you had to wait 6 months before you could even get the appointment to have it checked out and it turned into terrible cancer. No, that's not how it happens.
Yeah.
And in fact, I know this because one of my best friends who lives in England had kind of a weird spot on her boob. And she was like, I don't know, like I'm only, what was she at the time, 27? She's like, I'm only 27. This shouldn't be anything. I don't know. She got in right away because, again, they take things that could be breast cancer very seriously there, as we should.
Yeah.
And, like, within a few days, she had answers back. This isn't like, and also what's great is it didn't matter that she is a college-educated 27-year-old from, like, a real stable family with, like, a steady income. Mm-hmm. She still was able to get in and have this done. And whereas in our country, well, theoretically, yeah, you could have it done maybe even faster, but not if you're not a college-educated person or not if you live somewhere that just doesn't have good access to services,
right?
Not if you're low income, not if you come from a family that's maybe less stable. Like, you don't have those same barriers in these other places, and that's so important because, again, these are people's lives.
Yeah, and data suggests that those barriers truly do keep people from accessing care. And if you're not able to access care, then you might as well not have insurance, so.
Yeah, I have been in a position before where despite the fact that I have insurance, I still can't afford to go to the doctor. Mm-hmm. Like I still can't afford to pick up another inhaler or whatever it is that I need. Even though I have insurance and that's what I'm paying for.
Right.
And like, that definitely should not be happening to people. And I consider myself super freaking privileged. Mm-hmm. And that's happened to me before.
Yeah. So this doesn't fix the problem overnight, but it is definitely a step in the right direction, which reminds me of one of my favorite Barack Obama quotes, which is like that better is really good. Like, mm-hmm. I don't know.
Well, I talk about this with my therapist all the time because I'm a perfectionist at heart. And mm-hmm. I'm always just like, but perfect. And I can't be perfect. And what am I going to do? And she's like, okay, nothing is really, truly perfect. Mm-hmm. And so maybe instead of trying to be perfect, we just try to be better.
Yeah.
Like, let's just tomorrow be better than we were today.
Yeah.
So let's just bring our healthcare somewhere better than it was last year. And yeah, we're maybe never going to get to perfect, but better is
really good.
Better is important. And
yeah.
again, like, that's because these are people's lives, and that should matter.
Yeah.
I mean, especially if you have conservative friends who like to hashtag all lives matter whenever people are, you know, being not racist, and they like to spit back with that nice, catchy, super racist line. Like, be like, really? Are you sure all lives matter? Because I'm pretty sure the person you voted for is very against single payer healthcare. And we know that if lives really mattered, they would vote for it.
Yeah. No, there's all kinds. That could be its own episode for sure.
Oh, yeah. It should be its own episode.
Yeah. But I think it's really important, like, the overarching thing to remember is that healthcare is one of those things that the government can do better than the private sector, kind of like prison and education, because the goals of those things shouldn't be profit as much as possible. Like, for-profit prisons are awful, and you see the result of what happened. I mean, people are treated like completely inhumanely. Nobody is rehabilitated here. Like, recidivism is awful, and it's partially because of the prison system. I mean, again, like, the prison industrial complex could be its own, and probably will be its own episode. Totally, but like, education, there's public education, and like, nobody complains about that. That's a public good. But again, the goal of that isn't profit. It's teach kids and get kids ready for, I don't know, for the world. But yeah. So,
and I bet a lot of people who were complaining about public education aren't complaining about it now that the schools are closed.
Yeah. They're seeing how hard that is.
They're like, oh, teachers should be paid $1 million. Yeah,
sure.
They should.
Yeah. So the goal the goal in healthcare is to allow people to thrive in their communities, and that's happening here for people, mostly people with generational wealth, but it's leaving so many people behind, and it should be a right, and people shouldn't be able to get exploited because of it. So those were my like main takeaways about Medicare for All. Was there anything else?
You live in a country where losing your job or having an accident or like any illness or injury or like anything could just like sink you. And we shouldn't have a country where health equity is essentially non-existent. And like, we need to step up our game. Like, other high income countries have been doing it for years. We can do it too.
Yeah. That's a good point. We didn't even mention how crazy it is that health insurance is tied to employment here. That's not the case like almost anywhere else. Right?
Yeah. Like, no, like, if you're not employed in all of these other high income countries, like, you still have access to healthcare. They're not like, sorry, you
don't stop becoming a human when you lose your job.
Yeah, or retire, or it's broken. It needs fixing. It has for a very long time. Yeah. And I'm pretty sure the only people who actually love their health insurance are the ones who have never had to deal with them.
Right. Yeah. They're just scared of change.
And change is hard, and change is scary. Like, anyone who's paid attention to this Democratic primary and the debates where they're talking about healthcare reform, or basically since the very first breath of Affordable Care Act was like whispered into the ether, people know how contentious healthcare reform is. But with transparency and good communication from the top, and with listening to experts and actually investing in the people who have already put a whole lot into figuring out how to make this work, and a little bit of open-mindedness and a commitment to rational thought and not emotion-based, like partisan decision-making from us, the common people, we can have change we need in some vague amount of time.
Yeah. We didn't even talk about, I mean, like, what this would look like for people like going through this pandemic with or without Medicare for all. So like there are undoubtedly people who are without insurance because there's a huge number of uninsured people in the United States, much higher than other developed nations. There's going to be a huge number of people who get sick, need to be hospitalized for COVID-19, and then like go bankrupt later because of the medical bills. So I don't know if everybody saw that clip of Katie Porter arguing with the guy from the CDC about making testing free for COVID-19, but she basically like bullied him to get him to do it, which is like, thanks, dude, for doing the bare minimum. But it does bring up like a really interesting point. Like, why should testing for COVID-19 or for coronavirus be free, but not chemo? Like, why? What is it about other health? I mean, it's hypocritical. It's just that like you shouldn't be punished for getting sick. Like you're already sick.
And I feel like, okay, good start. Like your testing for COVID-19 and maybe treatment are going to be covered regardless of ability to pay. Like, I guess that's a good start, but let's continue.
Yeah,
like,
extrapolate that out to what that means. It means that like we would all be better off if we didn't have citizens going bankrupt because of medical emergencies.
Yeah. We can do it. Like we really truly can, and we really truly have to.
Yeah. So
I mean, we do. And maybe some of it's because America is such like this country, like I mean, we're from the Midwest. Like we get it, the whole Midwestern work ethic thing. And that whole, like, we are a country where it's like, no, you can do your American dream by working hard and all of this. And so it's just like, we're such a, like, we don't need help. We'll get it. Like, we are responsible for our own destinies. But, like, I'm sorry, but, like, cancer's not just, like, some destiny thing that, well, that's your own fault, so you got to pay your way. That's not how it works.
Nope.
Like, that is absolutely not how it works. And I could be hit by a car crossing the street and break both my legs and need like a bunch of reconstructive surgery that's super expensive and not be able to pay for the physical therapy that I need afterwards to be able to like walk again. And are you going to like look at me and tell me that, well, you know, you'll pull yourself out of there, you'll get your bootstraps or whatever.
Yeah.
Like, no, you're not.
Yeah.
And like somebody's ability to pay and their healthcare, like, shouldn't be impacted this way. Like, like, I get it. Americans, we are tough and we are so good at taking care of ourselves. Great. But like, that shouldn't have anything to do with our health care.
Yeah. Yeah, that just reminds me of like when people say, what is that saying? That like Americans all view themselves as like temporarily embarrassed millionaires. Like everybody thinks that they're going to be like a member of the 1% because all it takes is hard work. But meritocracy is kind of a myth, and especially if something like your health can like totally derail your life. Like this is not a country where like mobility between classes is very easy to do. A lot of the
hardest working people in this world, in this country, and probably the world, but are living under the poverty line.
Yeah, for sure.
Or are just like super middle class.
Yeah, it's like the essential workers that we're seeing now. It's not just healthcare workers, but also grocery and pharmacy, and the immigrants are still picking fruits and vegetables and like keeping this country running. Like there's custodians. Yeah, there's all kinds of people who, like you said, make less than minimum wage that are now considered essential, and we got some reprioritizing to do.
Yeah, and we should be valuing people's right to health care as like, that shouldn't have anything to do with their worth in terms of like economics, you know, right? Like we shouldn't be like, well, you know, economically you've contributed this much to the GDP of this country, so this is how much healthcare you can get, which is, I mean, no, it's not phrased that way, but that's kind of what we're dealing with here. And like, that's not it. That is not how this should be happening.
Yeah. Is there anything else you wanted to mention before we move on to like our actions for the week?
No, I think we should just move on because I bet people are tired of hearing me talk about this.
So in terms of actions, like long term, the answer is vote for candidates who support progressive policies like this.
Mm-hmm.
We don't have to be the country that pays twice as much for shittier health outcomes. So that's like the long-term thing. Another thing that you can do that's pretty easy and also you like have to is you can fill out your census. It only takes 5 minutes. You can do it online at my2020census.gov, and it has a huge impact on our democracy for the next 10 years until we have the next one in 2030. So we could honestly do an entire episode just about the census. I think it's really interesting. There's a really good episode of Stuff You Should Know about the census, but they use that information that you provide to determine how much federal funding your community gets for like education and roads and all that stuff, and how many representatives you get in the government. So it's important. It only takes 5 minutes. It's one thing that you can do to be like an engaged, active participant in our democracy. Okay, I have 2 more.
Okay, go for it.
Okay. If you have money to spare that you are looking to donate to progressive causes, I just set up today a $5 monthly recurring donation to Move On, which is an organization that focuses on digital advertising campaigns, which are like an even bigger deal now that there's a pandemic and there are basically no other ways to campaign right now. So right now they're focusing on messaging around like letting Americans know basically how shitty the federal government's response to coronavirus has been, because Donald Trump's approval ratings have gone up since the virus hit, which political scientists say is like normal. It's like a rally around the flag effect. But like the truth is that our response was really slow and really bad. And American citizens should know that. So that's, they do really smart, really cool digital organizing campaigns. So I decided that like that's a good cause, especially since like traditional ways to campaign are kind of dead in the water now.
Yeah, I love MoveOn.org. It's like one of my dreams to work for that organization.
Yeah,
that like they are awesome. I would love that.
Yeah. And then the last one is, if you don't want to do any of the other things, or maybe you do and you want to do this too, this comes out on Monday, April 6th. Nope. Yep. And my Indivisible group is hosting a virtual letter writing party over Zoom tonight. So it's at 7 p.m. Central Standard Time. You can put it on your calendars, and you can do it with us if you want to. So I needed like a commitment device, so this was perfect. But before you do it, you have to register for a Vote Forward account, and you can do that at voteforward.org. It's VOTEFWD.org. There's also a YouTube video that explains how to register and how to print your letters. You just search for Vote Forward on YouTube. It's 1 minute and 12 seconds long, and it's really good at explaining it. And then all you have to do is you print 20 letters. You need 20 business size envelopes and 20 stamps and a pen, I guess. And you can do it at any time. Like you can do it on your own. But if you want to do it with me and my Indivisible group, then we're doing that tonight at 7, and you can join our Zoom meeting. If you want to do that, send me a message on Instagram and I'll send you the link and the Zoom password. And if you're listening to this on Tuesday or later, then I'm sorry. And I'll give you more warning next time. But yeah, you can write those letters whenever.
Put it on social media.
To
like reach out, but we're not going to put the Zoom link on social media because that's how you get your Zoom hacked. And then you get like naked people or words that we're not going to say here. And we say a lot of the words.
Yeah. So putting a password on your meeting is a way to avoid all that nonsense. But so this one does have a password, and if you message me on Instagram, I will send you the link, and you can join my Indivisible group in our Zoom virtual.
It's so fun.
I know, I'm excited. Okay, your turn.
So a big thing, just like I love shopping local and all of that anyway.
Yeah.
And so if you know of local organizations that are either doing a lot of charity work right now and like trying to make sure that kids and stuff are fed, donate to them or help them out. Like if you're able to, and you know you feel like it is safe, like some of them, like even though we're not supposed to be gathering in big groups and stuff, they are taking precautions to make sure that doesn't happen.
Mm-hmm.
But it also means that like some of their volunteers who might be older and retired are currently afraid to or unable to volunteer, so you know they are accepting help, as well as check your local blood bank.
I was hoping you were going to say that.
Yep.
Yeah.
I made an appointment to donate blood. I was actually supposed to go today, but then I had a work meeting pop up, which is kind of annoying. So I had to reschedule it. But I'll be going next week instead.
Nice.
So yeah, like donate blood. All of the blood drives everywhere have been canceled. So make an appointment to donate blood. They do, at least my local place, and I'm assuming all of the other ones too, want you to make an appointment because, again, social distancing. They don't want 10 people to all show up at the same time or anything.
Right.
And that allows them time to do the cleaning and stuff they need. So do that and, you know, support your local businesses if they're open. Get takeout a couple times a week from a local place. McDonald's is not a local place, friends. But, you know, if you really need that McChicken, you do you. As well as like, so this is both something that I'm doing and something that's like been my happy for the week.
Yeah.
And a local shop is allowing like online orders, and you can actually just pick up the stuff that you've ordered, which is great because like people aren't just going to be going to browse around and buy some funky picture frames and, you know, goofy posters and stuff. So I love this place, and I would be super sad if they ever shut down. It's where I do all of my shopping for my friends. Okay, not all, actually. There's several places that I go. But anyway, it's one of my favorite small businesses here in Des Moines, and I ordered and picked up the best candle I've ever owned.
It is the best candle.
Oh, it's one of those like saint candles, and it's Moira Rose from Schitt's Creek. It was so hard for me not to buy the whole set. I'm trying to spend like $10 to $20 twice a week at different local shops because there's a lot really close to where I live. And you know, there's some awesome t-shirt shops and just like knick-knacky shops and stuff, and I need all of them to stay open, or where am I gonna buy your birthday presents next year? And I'm just so obsessed with this candle. I love it so much. Schitt's Creek is the show that's like getting me through this dark time. Catherine O'Hara is God's gift to this world, along with many other things. For sure. But, oh my God, I love her so much. And this candle is like making my work from home life so much better.
Oh, good. Yay.
I'm very excited.
Yay.
So yeah, what are you doing to make you happy?
Okay, wait. I want to Okay, I'm going to ask people to do one more action that would mean a lot. But if you would recommend this show to a friend of yours that you think would like it, that would mean a lot to us. That would be like a wonderful action that you could do. It's not huge, but it would mean a lot to us. And then I thought of like an actual self-care thing that I did this week that isn't just like superficial, but I've been not panicking, but like I've been real anxious a lot this week, which makes sense because there's a pandemic. Yeah. But I remembered something that my therapist taught me, and I was like, okay, it's worth a try. But do you know about box breathing? So it's like,
I feel like I do.
It's 4 counts breathing in, and then you hold it for 4 counts, and then it's 4 counts breathing out, and then you hold that for 4 counts. And that calms me down so fast. Like, that is like an actual useful, everybody start doing it. It was so nice. Like, I was like, oh, I don't need to take a Xanax as soon as I feel anxious. I could try and make myself feel better and do some self-soothing. So, yay, there's some actual self-care. Yeah.
Yeah, yeah, that is some real self-care. I keep like starting to do yoga, and I'm kind of proud of that.
Yeah.
And that I feel like is self-care.
For sure.
I did a headstand.
I saw. I was very impressed.
It's fun, except for then it turned into a pregnancy rumor.
Okay, that was your fault.
I was so dumb.
Your post was so ambiguous.
I was like, baby's first headstand or baby's first yoga pose, because it was my first yoga pose I decided to do with a headstand
baby.
that looked like the most fun. I am the baby.
Yeah.
And also I was surrounded by my fur babies, but that's a terrible word. But so I didn't want to use that. And it was just a whole thing.
As soon as I saw that Instagram post, I was like, I know Morgan means she's baby.
I'm baby.
But other people are absolutely going to ask her if she's pregnant.
No.
No.
Sorry, Mom. Not pregnant.
Ugh. There's enough babies in your family. Don't worry about it.
Okay, yeah, my family has so many babies right now, which is bringing me a lot of joy, because the oldest ones are at the point now where they're like talking a lot, and they
ask
definitely
for you.
Yeah, like they definitely love me and like know who I am. I'm not just like a person that makes them smile. I'm specifically Momo.
Yeah.
And so they'll like ask Momo, and then they'll like video chat me, and I'll get to see them, and it is giving me the will to live.
Yeah, that's very wholesome.
So cute.
The thing that brought me joy this week happened right before we started recording this podcast. An article came out in the New York Times. So this is partially sad, partially a bummer, but partially hilarious. But Anthony Fauci, the chief infectious disease credible person doing all of the press briefings, he needed increased security, in part due to like threats against his person. So like, obviously that's not great. Stop threatening Anthony Fauci. He's a treasure and we need him.
He's our only hope.
He's our only hope. But also due to fervent admirers. This 79-year-old adorable man needed additional security because he has fervent admirers. That is the best thing I've heard all week. Like, that's hilarious.
Yep, I absolutely love that.
I
love him. I would be a fervent admirer.
Yeah, I might describe myself. But like, not to the point where he needs additional security.
No, I would not be that fervent.
No.
Just like ferv.
We just stan Anthony Fauci. Okay. All right. Do you have anything else?
I think that's all my stuff. That's everything that I put on my list. I did put one more thing on my list, but it's super stupid. It's like a thing that I'm doing to bring me joy, and it's making use of my degree in kinesiology by posting workouts on my Instagram. I am like both thankful for them, but also resent them because they're so like accessible and easy to do that I feel like I have no excuse but to do them. So I feel like you posting them is going to move me like further along the change continuum until I eventually start exercising again. Okay, that's what I'm here for. Yeah. So, I'll keep them coming.
So it's almost working. Good work.
Almost working is going to be the title of my memoir.
No. No, just a work in progress. All right. Well, if you don't have anything else, then I guess we will talk to you guys next week.
All right.
Bye.
Stay safe, stay home, everyone.
Oh, yeah. And don't be a dick.
Don't be a dick. Don't be a dick. We're going to put that on a t-shirt someday.
Bye.
Bye.
Make sure you follow along on Instagram at FYMI Pod. Shout out to Hope Dye for the podcast art and Kyle Dibdahl for the intro and outro music and Ben Schlofelt for the audio production.
Please subscribe to this podcast, and if you like it, give us a rating and review. It makes it easier for other people to find us, and the more of us there are, the better. We come out with new episodes every Monday.